data, but it has to be recalled this year in April, we conducted a road safety campaign in Kenya that ran from here, Mombasa, to Malaba. And in Malaba, we tested drivers' health condition, the eyesight, the sugar level, the blood pressure, and what we came up with was about over 60% of the drivers had one or the other condition. And also talking to them, they did not have regular health facilities or access to health services. So to us, that was a sticking point. We thought that was a red flag, and we started thinking deeper and how do we enlist all our communities to participate in the transport sector. This was seen from the perspective of road safety, because if driver is not safe, because road safety is about the pillars: management, safe driver, safe vehicle, and safe and informed pedestrian. So we realized drivers were not as safe as we thought. It was not about driving skills, but about them and their own health. That took us further to think about the whole community along the corridor. And therefore, what we are going to do is, in this engagement, we are going to come up with three things. One is to have some sort of a structured or institutional semblance on how to handle this. Because health issues, now what happens in Kenya, Kenya reacts alone without the proper institutional setup that coordinates with the authority, other than traditional institutions that have traditional roles. One. Two, we are going to look at transcendence policies. What policies do we have that bring countries together to treat this as a common affair? Because drivers travel across the boundaries of the countries, and therefore they don't belong to one particular country. And then three, we will come up with operational interventions. So these are things that we are going to come up with. We're not going to come to a conclusive solution, but then a discussion towards this direction is going to be actually the most important thing to do. So once we have these structures in place, we have the institutions, we have the policies, and then now the operational intervention in place, then now it is easy to have data, because there will be a formula on how to interact with the communities and access information.
Our partner, North Star Alliance, is spearheading this program, and they have a lot of data through an integrated health management system that is running these clinics. And therefore, this data is collected daily. The numbers that you heard from the Executive Secretary visit these clinics almost on a daily basis. So we have a huge database of the different ailments and also emerging diseases that are coming up. And this information is relayed to the national hospitals in each of our member states for their immediate action. So that's the role that we play in terms of early detection and recommending policy actions by the member states. With regards to roadside stations, this is a huge program run by the Secretariat. We have several of these stations coming up, right from outside the port of Mombasa here in Kenya, where we have a facility at Bonje, and along the corridor. Private sector has been very active in developing these facilities, and our intention is to support them. Member states are developing guidelines and regulations on how these roadside stations should be developed and operated. And the private sector is taking up this very seriously. They are buying land, developing these facilities, and operating them.